Okay, shall we start? Okay, let us pray first. In the name of the Father, the Son, the Holy Spirit. Amen. Our Father in heaven, hallowed be your name. Your kingdom come, your will be done on earth as it is in heaven. Okay, so good day. So, shall we start? Okay na? Okay na yan. I-edit na lang. Okay. So, good day. So, for this clip, we will talk about potassium imbalances. So, you're done. We're done talking about fluid composition, fluid compartments, as well as we talk about fluid imbalances, like your fluid volume excess and your fluid volume deficit, correct? So if you have any questions, feel free to ask, or if not, wait for our online session for this specific concept, okay? So we're also done talking about sodium imbalances. You have your hyper and your hyponatremia. So for this clip, we will talk about potassium imbalances, okay? So what I'm going to do here is that I'm going to talk about, okay, importance of your potassium. What is that electrolyte all about? Okay, the effect of your potassium in the body, and the things are key you need to know for your examination. Okay? So when I say potassium nurses, okay, when I say potassium, what is the normal potassium level? The normal potassium level is 3.5 to 5.0 milli-equivalent per liter, correct? And I said yesterday that potassium is a form of an intra or an extracellular electrolyte. Thank you so much for your answer, okay? Potassium is an intracellular what? Cation or an ion? Positively charged or negatively charged? Can you still remember your pico? Can you still remember your piso? Piso, potassium in, sodium out. Piso is for cation, it's positively charged, correct? Pico, it's phosphate in, chloride out. Remember? And pico is an ion, negatively charged. Since we're talking about potassium, potassium is a form of an intracellular cation. Ibig sabihin, it is an electrolyte that can be seen inside the cell, and this electrolyte is positively charged. Okay? Next. When I say potassium nurses, do not forget that potassium is important for muscle contraction. Muscle contraction. And what else? Potassium is also important for your impulse transmission. Now this, okay, impulse transmission is so powerful in your NCLEX exam. Now that is why put an asterisk, okay, marking with your impulse transmission. The question here is that, what is the relationship of your potassium and impulse transmission? Please be reminded that your potassium and impulse transmission, these, okay, they are actually directly proportional. Okay, so don't forget that. They are directly proportional. Directly proportional. Ibig sabihin, if there is an increase in your potassium, there will be an increase in your impulse transmission. Correct? If there is hypokalemia, there will be decrease in your impulse transmission. Now that is why, with this specific concept, with this specific idea, this will give you a powerful tool when you talk about signs and symptoms of potassium imbalances. That is why if in your NCLEX exam you'll be asked, select all that apply signs and symptoms of hyperkalemia, increased potassium. So among the options, look for a manifestation that there is an increase in your impulse transmission. One good example is tachycardia. Am I right? So if tachycardia can be seen to patient with hyperkalemia, what about in hypoK? Syempre, bradycardia. Am I right? If in your hyperkalemia you have your diarrhea, what will you get in your hypoK? Constipation, paralytic ileus. Am I right? Are you with me? So this will guide you with respect to your signs and symptoms. That is why you don't have to memorize everything. You just have to understand what is the relationship of this electrolyte with respect to your impulse transmission. Maliwanag ba? Okay, next, another thing to remember. Now, when I say potassium nurses, okay, potassium, 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 don't forget. Okay, yung mga tinatawag po natin, potassium, potassium-rich foods. Okay? This is another trend in your NCLEX. Sometimes you'll be asked, among the food preferences below in the options, what specific food contains the least amount of potassium? In short, all options they have potassium. It's just that what specific food preference they're serving has a very low potassium content. That is why with respect to that potassium-rich food, do not forget your technique here, your PABOs. Okay? Your technique there, your PABOs. So what will be your arrangement and what are these foods? So ito po yung ating arrangement. You have your PABOs. PABOs. Okay, take note. Sa tabi ng PABOs, meron two opposing arrows. Don't forget this. There are two opposing arrows. Anong relevance niya? Ibig sabihin, if you start from letter P going down to your S, the potassium level decreases. But if you will start from letter S going up, going to letter P, the potassium content rises. Did you get that? Okay. So what are those foods, okay, rich in potassium? P stands for potato baked with skin. Okay? So you have here your potato baked with skin. A stands for apricot. Apricot. Dito sa Pilipinas, ang apricot ginagamit natin pang facial scrub. Correct? Anyway, B stands for banana. Oh, banana. So, tandaan, banana, saging yun. So, wag mo nang sagutin yung letter S na saging. Kasi banana na nga. Okay? Pag mo sumagot na saging, saksakin ko talaga. Okay? So, banana. Okay? O, that will be your orange. Orange. W, that will be your what? Watermelon. Watermelon. And letter S, that will be your what? Strawberry. Strawberry. Clear? Clear? So please don't forget your PABOs. Entiende? Okay, good. Next, another thing to remember about your potassium. When I say potassium nurses, don't forget that hyper and hypokalemia, these two, okay? Hyperkalemia and hypokalemia, they both manifest weakness. Can you follow? They both manifest weakness. Baka kasi sasabihin nyo na ang weakness, nakikita lang sa mga pasyente may hypoK. No. Weakness can be found both to patient with hyperkalemia and hypokalemia. Clear? Next, let's talk about hypokalemia first. Now, when there is a decrease in the potassium level, ano yung dapat tandaan? Pag bumababa ang potassium level ng patient, okay? At yung pasyente mo ay umiinom ng gamot na digoxin or digoxin or lanoxin, okay? Hypokalemia increases the risk of what we call digoxin toxicity. Okay? So if your patient is hypokalemic, there's a decrease in the potassium, and your patient takes this drug, digoxin or lanoxin. By the way, what is the classification of digoxin drug? Digoxin is actually a form of a cardiac glycoside. Okay? Another term for cardiac glycoside is digitalis. Can you follow? Tanong, why is it that when potassium level decreases, tumataas ang posibilidad na ma-overdose ka sa gamot na digoxin? Why? Because hypokalemia, okay, potentiates the effect or effects of digoxin. Ibig sabihin, pag bumababa ang potassium, lumalakas ang gamot na digoxin. Can you follow? That is why please be reminded, okay, on this statement. The partner of digoxin na electrolyte is potassium. The partner of lithium na electrolyte ay sodium. Did I mention that yesterday? Yes, I did. Very good. Okay? Please do not forget that. That's so important in your NCLEX exam. Okay? So your digoxin toxicity is common to patient with hypokalemia. Okay? Clear? Clear. Okay, good. Next. Another thing to remember is your hyperkalemia. Sir, Pag tumataas ang potassium level ng patient, okay, there is an increased risk of cardiac arrest. Cardiac arrest. Cardiac arrest is most likely to happen to patients with hyperkalemia. That is why do not be surprised that if a patient here is having renal dysfunction, just like a renal failure, remember sometimes you'll be asked, what specific indication or parameter that would give you an idea that dialysis must be initiated or started? Alam naman natin ang pasyente na may renal failure ay anemic. Alam naman natin yung pasyente na may renal failure may azotemia. In short, there's increased BUN, there's increased creatinine. Alam naman natin yung pasyente may renal failure, hyperkalemic, mataas yung potassium. Why? If you have renal dysfunction or renal problem, the ability of the kidneys to get rid of waste products is impaired. That is why increased BUN, increased creatinine are expected. It follows na pag renal dysfunction, hindi may papalabas ng kidneys yung potassium. That is why expected din, pag ang pasyente may renal failure, may hyperkalemia. Lahat sila present to your patient. But what is the best indicator that dialysis must be started? Your answer is hyperkalemia. Did you get that? Why? When the potassium level of your patient is so high, it can cause cardiac arrest. Mind you, may mga pasyente tayo na masyadong mataas ang BUN. Remember, the normal BUN is 10 to 20. 10 to 20. May mga pasyente na yung BUN yung umaabot ng 80, umaabot ng 100, but the patient is still walking. The patient is asymptomatic. That is why the best indicator here that dialysis must be started, initiated is hyperkalemia because of the risk of what problem? Cardiac arrest. Clear? Clear. Next. When I say hyperkalemia, increased potassium, pag tumataas ang potassium level ng patient, what are those things you need to avoid? Okay? So take note. Pag tumataas ang potassium level ng patient, you need to avoid the following. Number 1, you need to avoid ACE inhibitors. Remember, ACE inhibitor is an antihypertensive drug, correct? An ACE inhibitor is a drug or an agent that ends with what? Thank you so much sa sagot ninyo. Again, an ACE inhibitor is a drug that ends with K in what? Pril. Can you follow? It ends with pril. Give me an example of an ACE inhibitor. Correct. Very good. You have your captopril. 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 Am I right? Captopril is the most common ACE inhibitor. Please be reminded that an ACE inhibitor is a drug or an agent that prevents conversion of angiotensin 1 to become angiotensin 2. That is why if angiotensin 2 there is not possible to happen, then chances are potassium is retained inside. Kaya yung mga pasyente natin na may ACE inhibitor na gamot, tumataas ang potassium level. That is why pag tumataas ang potassium level ng patient, bawal magbigay ng ACE inhibitor because the more it increases potassium level. Now, with respect to your NCLEX exam, what is the common side effect of your ACE inhibitor? What is the common side effect of an ACE inhibitor drug? Okay, tell me. What is the most common ACE inhibitor that you know? Correct, captopril. Say captopril. Say captopril. Say captopril. Now say caftofril. Caftofril. Cough. Very good. So take note. The most common side effect of ACE inhibitor is cough. For your caftofril. Cough. Question. Is that a common side effect? Yes. Question in your NCLEX. Will you notify the physician? Correct. You're not supposed to notify the physician because that is an expected effect. Am I right? Now, when you will stop taking ACE inhibitor drug, the cough will also disappear. Did you get that? Always remember in your NCLEX exam, you will only notify physician if it is an adverse effect. Am I right? If that is an expected effect, expected condition, no need to notify. Are you with me? Are you with me? Okay, please don't forget that. Next, number 2. Another thing that you need to avoid if your patient is hyperkalemic, mataas yung potassium, ay salt substitute. Okay? Salt substitute. Salt substitute. Asin. Can you follow? In NCLEX, in the US, one good example of a salt substitute is Morton. Okay? Morton. Yung Morton brand ng asin. Am I right? Morton. Iba din po yung Norton. Antivirus yun. Can you follow? I said Morton. Why? Morton salt substitutes, they contain high potassium. Therefore, patient with hyperkalemia, never give captopril, never give ACE inhibitor, captopril, never give what we call salt substitutes because they will increase potassium level of your patient. Maliwanag? Maliwanag ba? Next, another thing to remember. When I say potassium level high, don't forget the rule of or the relationship of potassium and hydrogen. Huwag niyong kalimutan to Potassium and hydrogen are best friends. Okay? Potassium and hydrogen are best friends. Alam naman natin na pag ang tumataas sa katawan ay hydrogen, take note when hydrogen in the body is so high, it causes high, okay? Pag tumataas ang hydrogen sa katawan, it causes what? Acidosis. Am I right? If there's too much hydrogen in the body, it causes acidosis. Therefore, anong mangyayari kung may acidosis? Acidosis can cause or induce hyperkalemia. Can you follow? So take note. Take note. Hydrogen and potassium are best friends. Are best friends. Are best friends. Clear? Okay, that is why in cases of what we call acidosis, there is hyperkalemia. In cases of acidosis, there is hyperkalemia. Sir, how did it happen? Everybody stop writing. Everybody I see here, look. This is your blood vessel. Correct? Correct? Now, these are your cells, your cells. If there's too much hydrogen in the body, too much hydrogen, we call that acidosis. Correct? Now, potassium are inside the cell. Tama po ba? Because potassium is an intracellular electrolyte. These two are best friends. So when hydrogen now is in the body and there's too much hydrogen in the body, potassium be able to see his or her best friend. Am I right? So sabi ng potassium, friend, ikaw pala yan. Halika dito sa loob kasi mag-best friend tayo. Siyempre kung saan yung best friend mo, doon ka rin. Am I right? The problem there is hydrogen cannot get inside the cell because it's already fully booked. Did you get that? Na-occupy na ng potassium. Therefore, ang gagawin niya, lalabas ang potassium out from the cell and potassium now will give its space to your hydrogen. Hydrogen now enters the cell, potassium gets out. When potassium gets out, tataas ang potassium sa dugo. That is why, during acidosis, anticipate that there will also be hyperkalemia. Are you with me? Clear? Clear. Question so far? Clarifications? Clarifications? None? Are you sure? Okay, good. Pwede ka bang mabura ito na area? Okay, so what are we going to do now is that we will divide now your papers into two sides. On the left side is your hypokalemia, on the right side is your hyperkalemia. Okay, so you have your hypo-K, you have your hyperkalemia. Hypokalemia is a potassium level of less than 3.5. Hyperkalemia is a potassium level of more than 5.0. Okay? So you have your hypo-K and hyper-K. So let's identify. A patient with hypokalemia, it follows that there will be an increase in your impulse transmission. Correct? Samantalang ang pasyente po na may hyperkalemia, increased potassium, there will be an increase in your impulse transmission. Clear? Clear? Okay, good. Tanong, pareho ba silang may weakness? Yes. They both manifest weakness. They both manifest weakness. Okay? So tanong, because of increased impulse transmission, will there be tachycardia? Diarrhea? Hey, diarrhea. Increased peristalsis. Yes, that's your diarrhea, right? Hyperactive bowel sound. Yes, increase due to increase impulse transmission. Hypertension. Yes, sa kabila, baliktarin mo lang. That is why, don't make it hard for yourself. Do not memorize everything. You have to understand the problem. So kung alam mo dito tachycardic, sa kabila, bradycardic. Kung alam mo dito diarrhea, sa kabila, constipation. Did you get that? Okay, now balikan natin. Increased impulse transmission because of hyperkalemia will also increase the risk of cardiac arrest. Can you follow? Increased risk of cardiac arrest. Apart from that, an increase in the potassium level will also affect ECG tracing of your patient. And I believe I mentioned ECG sa previous clip. Correct? Sa previous discussion natin. So what are the different ECG tracings of a patient with hyperkalemia? Mataas yung potassium. Anong sabi ko? Patient here will have STI. Correct? So what are those ECG tracings of patient with hyperkalemia? S stands for ST. ST, segment what? Correct. Depression. T stands for T wave. That is tall. And peak. I stands for interval. What specific interval? PR interval, correct? That is prolonged. Can you follow? Can you follow? What about on the other side? A decrease in the potassium level would mean a decrease in your impulse transmission. Correct? So lumalabas yung weakness, pwede po. Kuha? And I said, a decrease in your potassium will increase the risk of digitalis toxicity. And it will also affect ECG tracing of your patient. What do you think is the ECG tracing of a patient with hypokalemia? Kung ang hyper, STI, ano naman ang hypo-K? You will have your UST. You will have your UST. Clear? Wait lang, ano? UST. So, ano yung UST natin? U stands for U wave. S, same with your hyper-K, you will have ST segment depression. ST segment depression. T stands for T wave, that is depressed or absent. Okay? Highlight in your exam. The classic ECG tracing of hypokalemia is prominent U wave. The classic tracing of your hyperkalemia is tall T wave. Okay, put some asterisk. Don't forget their classic tracings. Clear? Are you done? Are you done? Yes? Okay. Now let's proceed to what we call management. Okay? Pwede ka na bang mabura? Pwede na mabura?
Yes.
Okay. Okay, let's start with your hypokalemia. Tell me, what will be the management for patient with hypokalemia? And what will be the management of your hyperkalemia? Let's begin with the patient's diet. What is the diet of a patient with hypokalemia? Of course, you have to increase potassium-rich food. So now you know your PABOs. Remember your PABOs? Okay? Sa PABOs natin, food preferences, what specific food there contains the highest too much potassium content? Potato baked with skin. Very good. Okay? Next. Sir, mababa yung potassium level ng patient. How do we treat that? Siyempre, potassium supplement. So you need to give potassium supplement. Correct? Now in your NCLEX, please be reminded that the moment we give potassium supplement to patient, we need to check first renal functioning. We cannot give potassium supplement if the patient is having renal dysfunction because of the fact if you have renal dysfunction, potassium is not eliminated. It can cause hyperkalemia. It reverses the problem or it worsens hyperkalemia and then it can cause cardiac arrest. Okay? Don't forget that. So when you talk about potassium supplement, your priority action, okay? Your priority action is to check urine output of your patient. You check BUN, you check creatinine. Can you follow? You check potassium level. So if there is poor urinary output, if there is elevated BUN crea, if the potassium level is high, we cannot give potassium supplement. Can you follow? Speaking of urinary output, what is the normal urinary output? What is the normal urinary output per hour? Correct. The normal urinary output is 30 to 60 ml per hour. 30 to 60 ml per hour. Do not forget that the urinary output is greatly influenced by your GFR or glomerular filtration rate. So tell me, what is the normal GFR? The normal GFR is 125 ml per minute. Again, 125 ml per minute. 125 ml per minute. Please be reminded that when the GFR increases, the urinary output increases. When the GFR drops, the urinary output also decreases. These two are directly proportional. Okay? Clear? Next. You mentioned, Sir John, potassium supplement. Now, what are examples of your potassium supplement? We have a potassium supplement that is oral form. Can you follow? So what do you call the potassium supplement oral form? Answer, kalium durul. Okay? We call that a short kalium durul. Kalium durul. Kalium durul. Sometimes in NCLEX, they don't use kalium durul. They use another. They call that as K-dur. That is your kalium durul. Okay? They call that as K-dur or kalium durul. Highlight in your exam. Kalium durul as a form of a potassium supplement is gastric irritant. Okay? Don't forget that this is gastric irritant. Now, highlight in your exam. Any medication, any agent that is gastric irritant, you need to avoid citrus juices. Can you follow? Because citrus juices are also gastric irritant. So avoid citrus juices. Having said that it is gastric irritant, we know in your pharmacology that an agent that is gastric irritant must be taken with meal. Okay? Must be taken with meal. Finish? Hello? Good. Okay, let's proceed. Another medication as a form of your potassium supplement. Okay? So this is under your hypokalemia. So number 1 is your oral potassium supplement. Number 2, okay, another potassium supplement is potassium given parenteral. Okay? What do you call that parenteral route, parenteral preparation of potassium? Answer, KCl. What is KCl? Potassium chloride. Correct. Now, let's talk about potassium chloride. Now, when I say potassium chloride, what is the maximum potassium that can be given to your patient? Per hour. What? Correct. It's 10 to 15 milli-equivalent per hour. It's 10 to 15 milli-equivalent per hour. What if these two numbers came out in your NCLEX? 1, 10 milli-equivalent per hour. 2, 15 milli-equivalent per hour. Given yung 10 to 15, what will you choose? Choose the smallest value, the smallest number, and that is 10. Can you follow? But we know the max is your 15. Okay? Next. When patient receives potassium chloride, that's your KCl, always remember that we cannot give this drug bolus or in high concentration. Okay? So do not give in bolus. Do not give in high concentration. concentration. Question, why? Because it causes cardiac arrest. I hope you are aware that if a person is sentenced of lethal injection, okay, if a person is sentenced of lethal injection, the drug given to the person, okay, convicted is KCl. Kaya pag nagbigay tayo ng potassium chloride na nagbolus tayo, parang tayo nag-lethal injection sa pasyente. So never give that bolus or in high concentration. Therefore, having said that, tell me, what is the proper way of giving KCl? In short, it must be given via infusion pump. Correct? And it must be incorporated with your plain NSS. Okay? So don't forget this. So your KCl must be given via infusion pump, okay, and incorporated with your plain NSS. Clear? Incorporated with your plain NSS. Yeah. Clear? Hold on. Arrange ko lang yung aking video kasi hindi nababas yung nasa side. Sorry, saglit lang. Okay? Question so far? Naintindihan ito? Naintindihan ba ito? Good. Let's proceed to other side. Hyperkalemia. What will be our management to patient na mataas yung potassium level? Siyempre, will you tell the patient to consume pabos? No, because those are high in potassium. So what will you do? Avoid potassium-rich foods. So there will be dietary modification as well. So what will you do? Avoid potassium-rich foods. In short, avoid pabos. What else? In any type of electrolyte, okay, imbalance, specifically mataas, we always hydrate patient. Hydration is important. Tell the patient to drink a lot of water. Why? Drinking a lot of water, nurses, will dilute the blood. Can you follow? It dilutes the blood and that will decrease the concentration of electrolyte. Okay? Next. Okay, let's talk about meds. What medications will be given to your patient pag tumataas ang potassium level? Remember, too much potassium is not good. It can cause cardiac arrest. What medication will you give to decrease potassium in the blood? Nabanggit natin sa previous discussion, diuretic. Am I right? Tell me, what type of diuretic will be given to your patient that promotes potassium elimination? Potassium sparing or potassium wasting? Correct. We have to give potassium wasting diuretic. Can you still remember examples of potassium wasting diuretic? You have your BFHM, correct? BFHM. B stands for Bumex. I hope you can still remember that. Okay, previous discussion natin, Bumex. F, furosemide. That's your Lasix. H stands for hydrochlorothiazide or HCTZ. Hydrochlorothiazide or HCTZ. And last is letter M, and that is your mannitol. Mannitol. So Bumex, furosemide, hydrochlorothiazide, or HCTZ, and last is your mannitol. These are what we call potassium-wasting diuretics. Okay, next. Another drug given to patient with hyperkalemia is that a drug named Kayexalate. Okay, a drug named Kayexalate. Kayexalate. What is the generic name of your Kayexalate drug? Kayexalate generic name is sodium polystyrene sulfonate. The generic name is sodium polystyrene sulfonate. Sodium polystyrene sulfonate. Now let's talk about Kayexalate. Now, question. What is the route of Kayexalate administration? How do we give this drug? Not IV. How do we give this drug? This drug is given PO or enema. Okay? This is given PO or enema. Clear? Next. When we give Kayexalate, what do you think is the mechanism of action of this drug? What is the action of Kayexalate? Kayexalate is an agent said to be exchange resin. Okay? It is a form of an exchange exchange resin. Now, what do you mean by exchange resin? Para siya nag-exchange gift. I'll give you something, but in return, you give me a present. Can you follow? Okay, exchange gift. I will explain it in a while. Okay? Now, pag sinabi kong kayak-salate, tanong sa examination, what is the priority assessment prior to kayak-salate administration? What is your priority assessment? Okay? Priority assessment before giving kayak-salate. That is before administration. What is your answer in NCLEX? Answer, that is to check bowel movement. Can you follow? Always remember that if the bowel functioning of your patient is not good, that will render kayak-salate drug ineffective. The question here is, can we delegate LP and LVN to check the bowel sound of the patient before kayak-salate administration? Can we delegate that one, LP and LVN? Checking bowel sound before kayak-salate administration. Can we? Can we? Answer? No. Because that is a form of a prerequisite assessment. Did you get that? Remember, in delegation, we can delegate assessment that is routinary in nature. Routinary assessment. Example ng routinary assessment. Checking vital signs every 4 hours. That's routinary. Can you follow? Checking heart rate every 4 hours. That's routinary. Checking abdominal girth daily. That's routinary. Can you follow? Checking bowel sound every 4 hours. That's routinary. Pero if the assessment is a prerequisite before medication, before procedure, after medication, after procedure, prerequisite siya, hindi routinary. It cannot be delegated. Did you get that? So since it's a prerequisite before giving the drug, it cannot be delegated. Because this is not routinary assessment. Are you with me? Okay, good. Now, when I say kayak-salate, patient receiving kayak-salate, what will you watch out for? WOF. Watch out for. You have to watch out for, number 1, diarrhea. Number 2, you have to watch out for hypernatremia. Why did the patient develop hypernatremia when they received kayak-salate? Why? Because it's an exchange resin. So, paano nangyari yun, sir? Ito po yun. Remember that this is the intestine of your patient, correct? And the case of your patient is hyperkalemia. What medication was given to your patient? Kayak-salate. When we give kayak-salate, it is, what is the route? PO or enema. What electrolyte was given to your patient? Sodium. Am I right? Therefore, when we introduce sodium now is absorbed by the body in exchange of your potassium. Kaya exchange resin. So the body eliminates potassium in exchange of your sodium. So bababa ang potassium level because the body absorbs sodium. So if the body absorbs sodium, it puts the patient at risk to have what? Hyperkalemia. Am I right? That's stupid. Correct? Why? There are times in medical surgical nursing that disorder or disease, when you treat the patient, along the way, you give another disease. Am I right? Can you imagine? Yung pasyente mo may hyperkalemia. Binigyan mo ng kayak-salate, nawala ang hyperkalemia, pero nagka-hypernatremia. Pero nawala ang hyperkalemia. Pero nagka-hypernatremia. Pero nawala ang hyperkalemia. Pero nagka-hypernatremia. Maliwanag? Clear? So please do not forget this. Clear?
Normal din siya.
It is unexpected.
That's why you watch out.
That is why you have to watch out. Okay? Now, apart from your diuretics and kayak-salate, give me another medication that can be given to patient with hyperkalemia. Number 3, remember? It's number 1, number 2, and number 3. Another medication given to patient with hyperkalemia is insulin and glucose. Insulin and glucose. Question, sir, why do you have to give insulin and glucose to patient with hyperkalemia? Because potassium with the help of insulin and glucose enters the cell. Ulitin ko potassium with the help of insulin and glucose enters the cell. Ibig sabihin, sa tulong ng glucose at insulin, papasok yung potassium sa loob ng cell. Bakit kailangan papasok yung potassium inside the cell? Because potassium is an intracellular electrolyte. Remember, piso, potassium inside the cell, sodium outside the cell. Clear? So how did it happen? Okay, ganito yon. Pwede ko bang mabura ito na area? Okay. Look, this is your blood vessel. Correct? These are your cells outside. Tama po ba? What is the fluid inside the blood vessel? Plasma. Correct. Fluid outside the blood vessel, outside the cell. Correct. Interstitial. Naintindihan? Now, what happened? When we eat, the food, carbohydrate, glucose, sugar enters the body, enters the stomach, digested, metabolized. Can you follow? Detoxified by the liver, processed by the liver. Tataas ngayon ang glucose sa blood. What is the medical term for increased glucose in the blood? Siyempre, hyperglycemia. If the patient is hyperglycemic, tataas ang glucose level sa dugo, it stimulates the pancreas of the patient, particularly the islets of Langerhans of the pancreas is stimulated, okay? Specific cell will be what? Beta cells in the islets of Langerhans to release a hormone called insulin. Can you follow? So, ibig sabihin, insulin is released during hyperglycemia. Did you get that? Ano ang trabaho ng insulin? Insulin works as a key, susi. Cell wall serves as doors. Ibig sabihin, the insulin as a key opens the cell wall. If the cell wall is open, glucose can get inside. Potassium can get inside. But remember, hindi magiging susi ang insulin key pag wala siyang bit-bit na substance. Ipagpalagay natin na may dalawang kamay ang insulin. Itago natin sa pangalang Julio at Julia. Okay? Yung isang kamay ng insulin, ang bit-bit niya, glucose. Ang isang kamay ng insulin, ang bit-bit niya, potassium. If both hands carry something, glucose and potassium, okay? Glucose and potassium, that is the time insulin can work as a key. Can you follow? It opens the cell wall, dumping glucose inside the cell because glucose is an energy, potassium inside the cell because potassium is an intracellular electrolyte. That is why, taking into consideration, the case of our patient is hyperkalemia. Mataas ang potassium sa blood. Kung mataas ang potassium sa dugo, insulin is given and glucose. So analyze. When insulin enters the body, makikita niyo yung potassium. Friend, ikaw yan. Insulin holds potassium. Glucose is also given. Makikita ng insulin. Friend, ikaw yan. Glucose attached itself to your insulin. So both hands carry something. May glucose, may potassium. It acts as a key, opening the cell wall, dumping potassium inside the cell. Did it correct hyperkalemia? Yes, it did. Can you follow? So malaking tulong ang insulin and glucose if you want to correct hyperkalemia. So we cannot just give diuretic. Can you follow? Na akala mo diuretic lang pwedeng ibigay na potassium wasting, we can also give other drugs. In cases na severe at hindi makontrol, hindi ma-regulate, bring it down to its normal concentration, then the last option here is short dialysis. Can you follow? Kaya nga sabi ko, the best indicator that dialysis must be initiated, started, is hyperkalemia. Can you follow? Clear? Clear. Questions so far? May tanong wala? Wala? Okay, very good. So that ends your potassium imbalances. Okay? So let's proceed to another clip for another electrolyte abnormality.